Welcome to TCI Open Enrollment 2015. I'd like to share some exciting updates on the TCI benefit program effective August 1st. Open is the time of year for you to review the benefit changes with your families and determine what best fits your needs. At this time, you are able to enroll in a plan for the first time, drop coverage, add or drop dependents from your plans. A few important dates to remember. Monday, July 20th, 2015 is your deadline for making changes. All employees will need to make an active election on AP's Workforce Now website. And that you do make during this time will be effective August 1st, 2015 and will remain in place through July 31st, 2016. If you miss the deadline this year, you will have to wait until the 2016 open enrollment in order to make changes, unless you have a qualifying event. Qualifying event would include a marriage, divorce, birth or adoption of a child, or a change in status for either yourself or your spouse, allowing you to be eligible or ineligible for benefits. Of the Affordable Care Act or Health Care Reform Act or Obamacare. This is that all U.S. citizens have health coverage beginning 2014. And beginning 2015, the penalty for having no coverage will be up to 2% of your household income. It offers a variety of medical plans that meet the minimum essential requirements required by health care reform. You may enroll in one of the health plans available through the Marketplace Exchange. However, keep in mind that you will not be eligible for a subsidy. In order to review the plan features and costs, log on to healthcare.gov. The cost will vary by location, age, family status, and income. And because TCI pays for a large portion of the cost and deductions come out of your paycheck on a pre-tax basis, the TCI benefits will most likely be more affordable and will provide greater benefits, which a larger network of physicians. In 2015, TCI is required to complete a form for every single individual that was offered coverage on the TCI health plans. This form will be sent to your home with your W-2 as well as directly to the IRS, and it will indicate whether or not you were offered coverage and if you elected to participate in the TCI plans. The IRS will use this information to determine who is enrolled in coverage and to assess the penalties accordingly. What plans do we offer? There are 4 medical plans available through Aetna, 2 plans and 2 PPO plans. The HMO and the Aetna deductible HMO are the 2 HMO plans. You will need to select a primary care physician if you enroll in either of these plans, and you may only use network doctors. If you enroll in a PPO plan, it is slightly more costly. However, you do have the flexibility of seeing any physician you would like. You do not have to select a primary care physician, and you may use out-of-network doctors. The Bronze High Deductible Health Plan is the new 4th plan being offered this year, which I will go into detail in a little bit more shortly. This does have a higher deductible, which applies to all services with the exception of preventive care. This is the least costly option. There are a potential in out-of-pocket expenses should you need to use the services. Some of the features of both of the HMO plans. On the left is the deductible HMO. Many of you are enrolled in this plan today, and there is one change to this plan, which is the deductible. Please note this is a calendar year deductible, which will reset every January 1st, not with the plan year on August 1st. And the deductible is now $1,000 if you enroll as an individual or $2,000 for a family. The deductible only applies to your inpatient and outpatient hospitalization services and once you've met your deductible, you'll pay 20% of the charges up to an annual maximum of $3,500 for an individual or $7,000 for a family. Primary care physician, the copay is $30, and for a specialist visit, the copay is $50. Emergency room copay is $100, and if you are admitted to the hospital, the $100 copay is waived. Urgent care copay is $35. First urgent care center within your medical group. For any emergencies, consider using an urgent care center. The copay is much less and your wait time will be much less as well. Drugs at a retail pharmacy are $10 for a generic drug, up to $30 for a brand name drug, and up to $50 for a non-preferred brand drug. If you do take any maintenance medications on a regular basis, consider using the mail order pharmacy. You'll get a 3-month supply for 2 times the copay. There are also some new additional features to this plan for Arizona residents, which I will go into more detail on the next slide. The HMO is the high HMO, which is identical to the plan that is in place today. There are no changes. Again, you do need to select a primary care physician. There's no deductible on this plan, and the annual maximum is $2,000 for an individual and $4,000 for a family. Both primary care and specialist office visits are a $20 copay, and your inpatient hospitalization is a flat $500, while outpatient is $200. Emergency room is also a $100 copay, and urgent care is $25. For drugs, similar to the deductible HMO, are $10 for generic, $30 for preferred brand, and $50 for non-preferred brand. From both of these plans is covered at 100%. So your annual physicals, immunizations, woman, well child are all covered at 100%. Those are available at this time in California, Arizona, Nevada, Texas, and Georgia. If you choose to enroll in the Aetna deductible HMO and you live in the greater Phoenix area, you will have opportunity to participate in Aetna's new Accountable Care or Value-Based Care program. This is a collaboration between Aetna and Banner Health Network that focuses on clinical outcomes and reducing costs. The program strives to keep you healthy rather than just treating you when you're sick or injured. Included in the network are more than 700 primary care physicians and 3,000 specialists, more than 120 urgent care centers, 13 hospitals, 8 health centers, and 10 emergency centers. All of these physicians and facilities are working together to share data and create personalized health care plans for each member. If you choose to enroll in this plan and you live in Arizona, you must select a Banner Health Network physician by logging on to aetnanavigator.com. You can review the list of physicians by selecting Banner Health Network on the drop-down menu. Review of the PPO plan. There are no changes to this plan. As you see, there is an in-network as well as an out-of-network benefit. However, if you go out of network, your cost will be higher and you may be balance billed. The deal on this plan is $300 for an individual and $600 for a family if you go in network. Again, keep in mind that the deductible is based on a calendar year. Deductible applies to inpatient as well as outpatient services, and once you've met your deductible, the plan pays 20% up to the annual maximum of $3,300 for an individual or $6,600 for a family. Benefits are a $25 copay for primary care and $35 for specialist. Patient again is subject to the deductible, then a $200 copay, and 20% after the deductible has been met. Outpatient is 20% after deductible. Emergency room is 20%, however, the deductible does not apply. And urgent care is 20% as well, and the deductible is not applied as well. For drugs are a flat copay, $10 for generic, $30 for preferred brand, and $50 for non-preferred brand. Again, mail order is available as well at 2 times the copay for a 90-day supply. The plan that is available is a new Aetna high deductible health plan. And you can see that the deductible in network for an individual is $5,000. For a family, it's $10,000. Now, deductible on the other plans is an individual deductible, and each individual deductible has to only once if you are enrolled as a family. However, on the high deductible health plan, if you are enrolled as a family, only one individual has to meet the entire family deductible. So for example, if you and a spouse are enrolled and only you are incurring claims, then you have to meet the $10,000 deductible rather than just $5,000 per person, as is on the other plans. The deductible does apply to all services with the exception of preventive care. And once you've met your deductible, the plan pays out 20% up to the annual maximum of $6,450 for an individual or $12,900 for a family. And in addition to all of your office visits, hospitalization, all of the medical services, the deductible also applies to prescription drugs. So you will be paying 100% of the cost for your prescription drugs up to the deductible, at which time you will be paying the copays. You see an out-of-network physician, however, the deductible and out-of-pocket maximum are significantly higher, as is the coinsurance. So keep that in mind if you are considering this plan. You will want to try to see an in-network physician. This is the least costly in terms of your payroll deductions. However, if you were to have any services or if you were to be sick or injured, your out-of-pocket costs could be significant. On the Aetna medical plans is their teledoc service. This is available 24 hours a day, 7 days a week, and will allow you to access a physician through a phone or video consultation. Physicians are U.S. board certified in internal medicine, family practice, pediatrics, or behavioral health. This is a great resource for those of you that are on the road or away from home and is an affordable, convenient alternative to emergency room or even urgent care. Cost is equivalent to your specialist office visit but will not exceed $40. This is available to all Aetna members with the exception of those that participate in either of the HMO plans and live in California. Teledoc on Aetna Navigator and access care through video or phone consultations whenever you need it. Other benefits that are available through TCI include dental and vision. This year we have a new carrier. Cigna will be replacing Guardian for both dental and vision. The plans have free preventive visits and covers a large percentage of both basic and major services. Ortho benefits are also included for children as well as adults who are enrolled in the DHMO plan. The DHMO plan is new outside of California, so if you did not previously have access, take a look at this plan as it is a new affordable option for all employees. Also, vision is available through Cigna. They do use the VSP network, which is the same as the current Guardian plan, so you do not need to change optometrists. Also, you have just a low deductible for the exam and materials, as well as a frame allowance and a discount off of the remaining balance for both frames and lenses. The DHMO dental plan deductible and a series of copays for preventive, basic, and major services. Your screenings up to 2 per calendar year and x-rays are no cost, and additional services, both basic and major, vary by service. Please refer to the patient charge schedule, which lists out the more than 300 different services that are available. Ortho is also covered on this plan for both children up to $1,220 and for adults $1,720, and the benefit is for a maximum duration of 24 months. To a medical HMO, you must select a primary care dentist. You can search for a provider on Cigna's website. And if you do not choose one, you will be auto-assigned one near your home and can change it at any time throughout the year. The PO has an in and out-of-network benefit. There are dentists and specialists in the network for more flexibility. Use PPO Advantage dentists for the most cost savings. The deductible on this plan in the DPPO Advantage tier is $50 for an individual or $150 for a family. Services are covered at 100%, and basic services are covered at 80%. The plan pays 80%, you pay 20%, and that's after the deductible has been met. Services are covered at 50%, so both you as well as the plan pay 50%. Once the plan has paid out $750 on your behalf for the calendar year, you will pay the remainder of the cost for the year. If you choose to go to a Cigna DPPO dentist in the middle tier, these have contracted rates with Cigna, so you will pay slightly more out of pocket. However, you will not be balanced billed. If you go to network, however, you will be paying the coinsurance levels plus any amount above and beyond what Cigna determines is reasonable and customary. That are currently enrolled in the Guardian DPPO plans, either high or low, and take advantage of the rollover benefit that will continue with Cigna going forward. So if you do have an annual exam every year, you can add $150 per year to your out-of-pocket maximum up to 4 years. So if you get your annual cleaning this year and any additional services, your annual out-of-pocket maximum will increase to $900. Maximum roller is up to 4 consecutive years or $600. That is not covered on this plan. Below DPPO, the high DPPO also has a DPPO Advantage tier, a Cigna DPPO tier, as well as an out-of-network tier. This is a little bit more costly, so if you do have dental work planned in the next year, you may consider enrolling in this plan, as the annual maximum is up to $1,500 per individual. And there's no deductible if you do go to a DPPO dentist. No cost for preventive care, your oral exams, as well as x-rays. And you will pay the coinsurance for the applicable services. The plan is 80% for basic on DPPO Advantage. You pay 20%, and the plan pays 50% for major. You pay the remaining 50%. The vision is also administered by Cigna beginning August 1st. An exam you can receive once every 12 months, and the copay is $10 if you go to an in-network optometrist or ophthalmologist. The materials copay is $25, and after the materials copay for lenses, the plan pays 100% for your standard lenses. You can also receive a new pair of lenses every 12 months. You can receive every 24 months, and the plan pays up to $130 and then pays then you receive 80% off the remainder of the balance. And then you pay 8% of the balance over $130. Is you can receive every 12 months in lieu of frames, and the plan also up to $130. Our allowances are as follows. You can be reimbursed for an exam up to $45, reimbursed for eyeglasses ranging between $32 and $82 depending on the lens type, and the frame reimbursement is $71. Contact lens reimbursement, $105. To the life and disability programs. These programs are administered by Mutual of Omaha, and there are no changes in these benefits. Basic life and AD&D is provided at a flat $25,000 benefit for all eligible employees. If you need more insurance, you may purchase additional voluntary life insurance for yourself, your spouse, and your children. For yourself, you may purchase in $10,000 increments up to 5 times your earning or $500,000, whichever is less. If you purchase additional insurance for yourself, you may also do so for your spouse in $5,000 increments up to $100,000. For your children in $2,000 increments up to $10,000 per child. Please that employees and spouse, if you are enrolling at this time in voluntary life insurance, you will be required to submit a brief medical history questionnaire in order to be approved. A history questionnaire is not required for your children. 2 disability plans available as well, a short-term disability plan and a long-term disability plan. Just like insurance for your paycheck. If you are ever to be injured or become ill and are unable to work for an extended period of time, the short-term and long-term disability cover you and pay out of your earnings. For the short-term plan, California employees have California state disability, which is a benefit of 55% of your weekly earnings up to a maximum of $1,104 per week for 2015. You may voluntary short-term disability, which is 30% of your weekly earnings up to $1,000 per week. For reside outside of California and do not have a state disability program, you can elect voluntary coverage, which pays 60% of your weekly earnings up to a maximum of $1,250 per week. Benefits will begin on the 8th day of disability and will continue for a maximum duration of 51 weeks. At that time, if you are enrolled in the long-term plan, it will dovetail. There will not be any gaps in coverage, and the long-term plan pays out on a monthly basis 60% of earnings up to $5,000 per month. It also offers an employee assistance program, which allows you to have 24-hour access via telephone, up to 3 face-to-face visits. The program is available to you as well as your household members at no cost and is 100% confidential. This provides referrals for child care, elder care, legal consultations, financial services, as well as referrals, counseling for any work-life stress situations that you may be confronted with. What about the other stuff? Many participate in the Vitality Wellness Program through ADP. Beginning August 1st, we'll be rolling out a new enhanced version of the program. You will need to re-register and download the new mobile app. However, I think you will find that the new program has many more features and is easier to use. If you enrolled in any of the TCI medical plans, you and your spouse, if they participate as well, are eligible for this new Vitality Wellness program. Similar to the current program, you will accumulate points for completing a health review, participating in physical fitness activities, getting annual preventive health screenings, and completing health management courses, just to name a few. Status changes from bronze to silver, gold, and platinum. You will receive a credit on your paycheck to offset your medical contributions. This ranges from $5 per week for bronze all the way up to $20 a week for platinum. That's more than $1,000 per year if you are at platinum level. Please note that your points and status level will reset with the new program on August 1st. However, the status level that you have reached as of July 31st of 2015 will remain in place for the remainder of the year through December 31st of 2015. This will allow you some additional time to accumulate points from August 1st to December 31st. Contributions will then be adjusted on January 1 based on the status level that you have reached. Costs increasing year over year, which is attributed to a variety of factors. One of the most significant and controllable factors is our large claims. We need to take a proactive approach to our own health, and TCI has provided us the resources to do so. The company is investing a large amount of money in the program and is paying eligible employees to participate. We take advantage of this great new program and will take charge of your own health. Please be on the lookout for more information coming on. For those who are considering enrolling in the new high deductible health plan, because of the way the plan is structured, the IRS allows us to set up a health savings account, an HSA account, to set aside money pre-tax in order to pay for health care related expenses. Health savings account is regulated by the IRS. There is a maximum allowable contribution, which is $3,350 if you enroll as an employee only, and up to $6,650 if you enroll as a family. If you choose to contribute to an HSA account, you determine how much you would like to set aside for this account during open enrollment, and deductions will be taken out of your paycheck each pay period. Please note that state income tax may apply. Funds related in your health savings account may go towards deductibles, copays, prescription drugs, dental services, as well as vision care. If you're interested in enrolling in the high deductible plans and have further questions regarding the HSA account and how it works, please see Human Resources. Aid funds may only be used for qualified health expenses. If you do use the funds for any non-qualified expenses, you will pay income tax as well as a 20% penalty. Also, you will want to save the receipts and any other documentation in case the IRS requests them. You do not need to submit receipts for reimbursement. However, if you were to be audited by the IRS, they will request documentation. What will plans cost this year? Pages 24 and 25 of your benefits guide includes the costs for each of the medical, dental, and vision plans. The disability plans vary by your age as well as your income. So you can log on to ADP to determine what your cost and benefit level will be. This reflects the weekly costs for the net deductible HMO on the left, the high HMO in the middle, and the Kaiser plan on the right. Available to those that are currently enrolled in the plan but is not open to new participants. Please HR if you do have any questions regarding the benefits or plan design. There are a few changes. For the remaining medical plans are shown here. On the left, the Aetna PPO plan for those that have an HMO plan available. So for that reside in California, Arizona, Nevada, Texas, and Georgia. If you choose to enroll in the PPO plan, you'll be paying the costs on the left. $76.05 for an employee, $212 for employee plus spouse, $176.54 for employee children, and $326.97 for a family. For the employees that do not have HMO access available, you will be paying the cost for the PPO plan in the middle column. Those that choose to enroll in the new high deductible health plan, you will pay the cost on the right. As you can see, these are less than the other plans that are available. However, again, keep in mind that there are significantly high out-of-pocket costs associated with this plan. Need to do. All employees are required to log on to workforcenow.adp.com, even if you are not making any changes. Because you have some plan changes and a carrier change, all these will need to log on to make an active election. On the right of the screen is a snapshot of the 2015 Employee Benefits Guide. This is a great resource for you to keep throughout the year. It includes the plan overviews, contact information, week elections, and the annual legal notices that we must distribute. Monday, July 20th to make your elections. If you do not enroll, your benefits will terminate as of August 1st. Find out more information. There's a mobile app that is specific to the TCI benefits program. It includes all of the details that are included in the benefits guide, including plan overviews, contact information, cost and quality information of common health care services near you, wellness tips, as well as definitions. You can download the free app on either the Apple Store or Google Store by searching BenIQ, and the username you will enter is TCI. Also take a photograph of your ID card, your medical or dental ID cards, and store them in the app for use when you go to your physician. That is available. Should you have any questions regarding the TCI benefit plans, whether it's medical, dental, vision, life, or disability, is new benefit counselor. You can call toll-free at 844-664-2044 and speak with a representative who is familiar with the TCI benefit program. Questions regarding a copay or how a plan works, or if you need help locating a physician, the benefit counselor would be happy to help you as well. Reach out to Sylvia or Rich in Human Resources and Commerce if you have any questions or need help enrolling. Don't forget, the last day to make changes is Monday, July 20th, 2015, and your benefits will be effective on August 1st.